Hi, okay, so this is the twin block functional appliance. It comes in two pieces. So if you have a look here, it comes with the top part, which clips into the top teeth like this, and it comes with the bottom part as well, which clips into the bottom teeth like that. And basically, the idea of a twin block is, well, twofold. It's very good at retracting the prominence of the upper teeth. So if your teeth stick out, it's very good at pulling the upper teeth back. And the other thing it's very good at treating is patients with deep bites. So that means when the top teeth cover the bottom teeth too much in the vertical direction. And the problem with that is you can get a lot of wear and tear to your lower teeth over the longer term. So if you've got a combination of prominent upper incisors and a deep bite, this is an absolutely terrific appliance to address your malocclusion or your bite problem. So the way that it works is that the top piece and the bottom piece are placed in the mouth together. They only work when they're used in tandem. And when you go to bite, you would normally hit the blocks like this. But there's little guide planes on it, which ensures that you slide your jaw forward so that the teeth are biting with the incisors sort of edge to edge, near enough the final position. And how it works is the lower blocks pull on the upper blocks and vice versa, to pull the upper teeth back and the lower teeth forward. So in order to address the prominence of the teeth, there's a combination of the upper incisors retracting and the lower incisors protracting, which means leaning forward. So i.e. the upper teeth coming back and the lower teeth coming forward. Whereas sometimes an alternative plan is extractions of two upper premolars, but in that case, you're simply moving the upper teeth back. Now, this is an absolutely terrific appliance for addressing these sort of malocclusions. Some people will run them for 9 to 12 months. I personally run them for about 6 months, and I can see a significant improvement in that time. And then more often than not, you progress on to fixed braces. Now, this is not an easy appliance to wear. It is very important to know that from the outset and to prepare yourself. The first 2 weeks are incredibly difficult. In the first 2 weeks, you will, well, first off, you won't like the 2 lumps of plastic in your mouth. I wouldn't like 2 lumps of plastic in my mouth. And so it takes a little bit of getting used to. But on top of that, you will suffer from some jaw ache. You will, your muscles will be stretched and you may get some headaches. And so you just take whatever you would normally take for a headache, either paracetamol or Calpol if that's what you take, or ibuprofen. You will also, your speech will be affected considerably in the first week. I generally, with my patients, just ask the patient not to wear it during school hours in the first week, and then hopefully by the second week the speech is pretty good. The reason why I do it that way is because I don't want you to have to go to school and then have the mickey taken out of you, and then it's unlikely that you're going to wear it. But some clinicians will make you wear it full time from the outset. The other things that you're going to suffer from is you're going to be quite dribbly in the first week. You're going to hypersalivate because your mouth is going to see that there's something in the mouth and it may be mistaking it for food. Hence why you're going to produce too much saliva and you may become a little bit dribbly. Then after the first 2 weeks, you shouldn't, generally speaking, for whatever reason, people aren't too bothered anymore about having these 2 lumps of plastic in their mouth. Their jaw ache tends to go, the speech is good, and the hypersalivation, so the dribbliness, goes away. And then after that, it's pretty much smooth sailing. Probably about 8 or 9 people out of 10 will get through that first week and get the terrific outcome that's required, that this produces. 1 or 2 out of 10 won't wear it, they never get through that tough phase, and then you have to look at alternative options. But yes, this is called a twin block functional appliance, and it's fantastic.